I just want to take a few minutes here before we go pick up my son from school. And I want to talk about financial toxicity. And I know it's a huge subject to talk about. But I want to just quickly talk about it really fast. On the blog, cancerisанasshole.com, we have two different blogs about it because it's really a really big topic. We don't hear about it too much, but there are so many institutions, there are so many foundations, there are so many corporations that help people that have cancer, and it's because it's such a financial burden. In medicine, we use the term financial toxicity to describe problems that patients have related to the cost of medical care, because it is astronomical. Cancer is a big burden. Financial toxicity is huge. A number of studies show that cancer patients and survivors are more likely to have financial toxicity than are people without cancer. The level of financial toxicity you may have will depend on a number of factors in your household. But cancer treatment can affect your ability to work and pay bills, of course, depending on your stage also. Now, there are a number of factors, your stages of cancer, your medication, your treatment, factors, what type of cancer you have, where you're getting your treatment. Are you traveling for your treatment? Which hospital are you going to? Are you going out of state? Do you need lodging? The kind of car you have, how much gas you need, the oil changes, the fixing your car. Sometimes cars break down. There are so many factors in cancer treatment. You need to eat good. Cost of food is expensive. Cost of organic food is expensive. Cost of good, healthy food is more expensive than cheap, crappy, not good food for you, sugary, fatty, disgusting food. Why is that? The term financial toxicity and financial distress are used to describe how out-of-pocket costs can cause financial problems for a patient. Out-of-pocket costs are what you pay for medical care that is not covered by your health insurance. Out-of-pocket costs include co-payments, which are the amount you pay for each healthcare service, such as doctor's appointments or prescriptions, which I do have health insurance. I just went to go pick up a mouthwash because even though I am in remission right now, it's only been 2 months. It will be 3 on the 14th. I have thrush from having chemo. My body's healing. I'm still taking medication, and it's $774. Crazy amount of money. Ridiculous. That's an out-of-pocket costs. That's expensive. I don't have that much money to get a medication that I need for me. It's astronomical. Deductions. The amount that you have to pay for your medical care before your health insurance plan begins to pay, which so many people have. Usually it's between, like $1,000. Sometimes it's $500. Sometimes it's $5,000. A lot of times people don't have that, but that's the amount of money that you do have to pay. Sometimes that's the health insurance that you do have, and sometimes that you get that health insurance not realizing that you are going to end up being sick. And coinsurance, the percentage of cost that you have to pay for a service that your health insurance covers after you have paid the deduction. For example, you pay 20% of the insurance and the insurance pays 80%, kind of like a Medicare type of situation. The cost can be for hospital stays, out-of-patient services, such as procedures and tests that can be done without staying overnight in the hospital, medical appointments, and prescription drugs. Expensive. That's not covering needles. That's not covering doctors. I just want to get the word out, because it is super expensive. Having cancer is an expense. Cancer survivors usually report higher out-of-pocket cost spending than people who have not had cancer, obviously. But some cancer survivors report spending more than 20% of their annual income on medical care, which to me is upsetting. And I think that we need to do a lot more to help the people who are diagnosed with cancer, because it is not just adults, it is children who can't fend for themselves, and we need to do something about it. We really need to, the medical community, we need to do something about it. So the financial toxicity may also be called, you may hear financial stress, financial hardship, financial burden, obviously. There's no randomized clinical trials studying cancer patients and financial toxicity, which I don't know why there isn't. The information in this summary is mainly based on studies that only include patients with certain cancers and survivors. So it may not apply to all cancer patients, but for the most part, for the people I've spoken to, I also have the web source. This is from my website, cancerisandasshole.com. All information that I do have, all information posted, you will see a blue link that says web source that will, if you click on it, brings you right to the website that everything is posted, that everything has been taken from. All cancer survivors that I've talked to, all cancer patients that I have talked to, families, people, cancer is a big stress. Money is a big stress. We need to do something about it. A number of studies have shown that cancer patients and survivors are more likely to have financial stresses. I want to point that out, that no matter what cancer you have, whether it be leukemia, breast cancer, testicular cancer, ovarian cancer, brain cancer, whether you be a child and your parents have to pay for it, whether it be an elderly person, whether you have Medicare, whether you don't have insurance, it doesn't matter. You should have to focus on surviving, and you shouldn't have to focus on how much does this prescription cost, should I get it, do I have enough money to buy this prescription, do I have enough money to actually afford my treatment, or do I have enough money to pay for my child's chemotherapy, do I have enough money to survive this? It should not be a question at all whatsoever. And I'm really passionate about this because I'm not rich at all whatsoever, and my family has been through this, and being in the hospital, I've seen survivors be through this, and it should not at all be a question of, am I going to survive because I don't have enough money to? At all whatsoever. It should not be a question. So, if you need help, you can go to www.cancerisанasshole.com. I do have a pages tab where you can click on sources or help. I forget I forget what I put. It's called support under my pages tab, and you can see different sites. The American Cancer Society has things you can fill out. You can call them 24 hours a day, 7 days a week, and you can get help. You can go to cancercare.com. There are so many sites you can go to find help. You can get resources. You can find help in your area. Criticalmass.org is a wonderful site you can go to. You can find help. You can put in your zip code. You can find charities. You can get money for anything that you need. It is, I'm telling you, if you need anything, you can email me. I will help you find something in your area. It doesn't matter where you live. I am so passionate about this. I want to get the word out for everybody. Financial toxicity sucks. It 100% sucks, but you're not alone. If you're watching this, you're not alone. But I don't want you to not have treatment because you cannot afford it. I will get you help. Trust me, there's help out there for people who need it. The level of financial toxicity you may have will depend on a number of factors in your household. When you're diagnosed with cancer, the following factors in your household may affect your risk of financial toxicity. Whether you make the most money in your household, how much money the other people in your household make, how much debt you have had before you were diagnosed with cancer, your assets, costs related to your cancer, how much cancer is and the treatment, your ability to work while you have cancer, whether or not you have a health or disability insurance and what they cover. All of these things. I'm telling you, please visit my site. Please, if you need something, you can email the site. It sucks. I know it sucks, but you're not alone. There's so many other people out there. I do not want you to not get help because of financial toxicity. This is a movement. This is a big movement, but we are going to figure this out. Thank you so much for listening to me. Thank you so much for watching this. Thank you so much for being there with me. We are going to figure this out. Thank you. Have a great day. Bye-bye.